My name is Amos Chweya. I work for JSI as a regional immunization technical officer, more so working in the area of immunization supply chain. I am currently based in Nairobi, Kenya, and I support the country on the same matters, immunization supply chain, and mostly dealing with the effective vaccine management and cold chain. I have been asked some questions and I would want to respond to them as follows. The first question is how the emergency of COVID-19 has affected vaccine and cold chain management in the country. I would want to mention that the COVID-19 emergency has had really a very minimal effect on vaccine and cold chain management in the country. The country, since the first case in March this year, has not had any vaccine stockouts reported anywhere in the country, which that's why I'm mentioning that the effect has been a bit minimal. And other than having a few cases of lack of transportation to deliver vaccines to sub-county stores, and transporting cold chain technicians to respond to cold chain breakdowns in various facilities within the country, we really haven't seen a much effect on vaccine distribution. We have also had some delays in scheduled vaccine arrivals initially, because vaccines from manufacturers used to come to the country through passenger flights. And as you remember, most of the passenger flights were canceled during that period. But later we were able to have the vaccines come in through the cargo planes. So again, as I mentioned earlier, we really did not run short of any antigen. Going forward, what we saw as we moved on is that we had reduced consumption of some of the antigens, especially the HPV vaccine, where we were forced to postpone shipments of one consignment of a vaccine to the country because the uptake of the vaccine was low, and therefore we could not have enough cold storage to hold that other consignment. So we were forced to, the country was forced to postpone that shipment to a further date. In general, I would want to mention that strategic planning and management has really helped in ensuring that the facilities had adequate stock throughout this period of the COVID emergency. The other question I have been asked is, what is Kenya doing to monitor where vaccine stockouts are happening and how they are addressing the issue? Again, as I mentioned, we didn't have any vaccine stockouts, but to make sure that every facility, every sub-county store had vaccines, we made use of the existing vaccine logistic management system, which is called Chanjo, updating it constantly, monitoring it, and making sure that no facility is lacking the vaccine. We had two platforms that were used a lot just to make sure that people are communicating and information is being shared. And we had the WhatsApp and the Telegram groups that most sub-counties and facility are members, and they use those platforms to report any anticipated stockouts so that a response can be made. And this, wherever we saw that stocks were going down, the country was able to supply from the next level or even ask for redistribution within the facilities within a given catchment area. So one thing to note here that has worked very well for us is the WhatsApp and Telegram groups. The last question that I was asked to respond to is what is one best practice Kenya can share with health workers from around the world to mitigate issues with vaccine stockouts. One best practice we can share is the issue of reviewing stock status. Periodic and scheduled review of stock status really helps a lot to know where the stocks are going down and where one needs attention. So the use of WhatsApp groups and Telegram groups really worked very well to make sure that everybody knew what was happening at every facility within the country. There is this saying in the country that you don't have to wait until you are stocked out to report. So this again was overemphasized that people need to report, check their stock status and report whenever the stocks are going down for them to be resupplied. The issue of making sure that you have enough buffer stocks to avoid going below minimum stocks. That is very important, I think. People need to have enough buffer stocks. I invite you to join our upcoming panel discussion, which will be held on September 24th. Please submit any questions that you have about cold chain management or other elements of routine immunization when you register to ensure that the session is as engaging as possible. I hope to see you there. For opportunities to connect with webinar participants and experts in advance of the live session, please join the supporting supervisors during COVID-19 learning group on the Boost